Okay, so we have a couple minutes left, and Dr. Wynn, I just want to let Dr. Wynn know that we did receive his message about doing a study and the emerging consensus that medical treatment has improved. And so I was telling Gary before the meeting started that I have reached out to our Office of Research about the study that Dr. Wynn would like us to do. But Dr. Wynn also has another question. Are all Kaweah Delta COVID beds full? He heard a 100% comment at the beginning of the session.
Right.
So are COVID areas?
No. Sorry, Dr. Wynn, if maybe I skipped over that. So we have 4 units that have been dedicated to the treatment of COVID patients or those with respiratory suspected COVID. So that's the ICU, 3 West, which is our intermediate critical care unit, 2 South, which is a 29 bed medical surgical unit, all isolation rooms, and then our 12-bed pediatric unit. We have 12 open beds among those 4 units right now that are available. I do appreciate Dr. Wynn's, it's a great question. Dr. Wynn's suggesting that maybe we look back to the beginning of the pandemic, and you know, we've had hundreds of COVID admissions now, and to look at the differences in the care that has evolved over time and how the effectiveness of that care. You know, now I was up on the ICU earlier this week, rounding on the staff and the physicians there. And I was talking to one of the critical care physicians, just, you know, what is the standard protocol, treatment protocol now of COVID patients? And he pretty much said, you know, it's the 5 courses of remdesivir, the anti-malaria medication, and then convalescent plasma. And I was surprised by that because I'd heard initially that we weren't really using much of the antibody-rich plasma that's come from a recovered patient. But he said that's pretty much the standard treatment. And it's become increasingly effective. Mm-hmm. And so it gets patients off of a ventilator quickly. If given earlier in their treatment, it actually could keep them off a ventilator altogether. Dr. Wynn is right on target to say, you know, just as we've become better and better at taking care of COVID, mm-hmm. And we have more and more recovered patients, you know, it would be very interesting to look back over that. Mm-hmm. I was going to add to the question on the financial, you know, dispelling the beliefs out there. So remdesivir, we've been receiving allocations of remdesivir from the federal government now free of charge. Mm-hmm. But next week, we will now have to purchase it through Amerisource Bergen for $3,200 per 5 vial treatment. So every patient generally gets 5 vials of it. A kit of 5 vials is $3,200. So Kaweah Delta will have to pay that to the distributor for mm-hmm. each and every COVID patient. Mm-hmm. There is 0 reimbursement for it. So Medicare will still continue to pay us that same respiratory disease DRG, that same payment amount, even though we now have to start paying $3,200 for this treatment of remdesivir, which we want to give to every single COVID patient. Mm-hmm. So that's a new cost with 0 reimbursement coming from the government. Very disappointing.
Yeah, that is disappointing.